I take a little bit of a different approach. A lot of times when people think they're going to come to a dietitian, they expect the dietitian to go over what they're eating and then just give them a meal plan. And that's not typically the approach I take. I really look at the person as a whole. I see them as a whole wellness perspective. I really look at the stress that's impacting their life, potentially relationships, work stressors, financials, and see how that's impacting their weight. Because oftentimes it's not just the food, it's everything else that's causing their weight to increase, because it could be they're emotionally eating, or they're just not learning how to cope with that stress. So I really try to get to the root of the problem so that we can bring them long-term success in the end. I went to school at Minnesota State University, Mankato, for 4 years. After graduating from there, I had to do a year-long internship in Illinois, in Peoria I went to. And throughout that internship, we do all sorts of rotations, both clinical in the hospital as well as outpatient. And that's where I really fell in love with counseling patients. We were fortunate to be able to counsel at-risk, low-income patients during that time. And that really gave me a lot of experience. But what brought me to the field of dietetics was my experience with weight and struggling with weight as a child. And so understanding really that connection and that relationship with food, and how difficult it can be to lose the weight and have people not understand that it's more than just food. So currently I do specialize in emotional eating and disordered eating, but I do see patients from kids all the way up to the elderly in all areas of nutrition. So it could be anything from Crohn's disease, celiac disease, eating disorders, weight loss. I also see patients for weight gain. They might be struggling with cancer treatment and some of those side effects, so with weight loss. I also see patients who have food allergies and need help with just really looking at the food labels and figuring out what foods can they eat on that meal plan. I work with a lot of patients with irritable bowel syndrome. We also see patients for kidney disease. So really there's a lot of opportunity for nutrition interventions. Diabetes is a really progressive disease. So the quicker we can work towards preventing it or prolonging it, especially at that when we start seeing patients developing prediabetes, the more likely we are to decrease your risk of getting that type 2 diabetes. And so that's where nutrition comes along. Nutrition is the foundation to prevention and the foundation to health. So if we can get you right away when we start seeing blood sugars come up, we can definitely prolong how quickly type 2 diabetes develops. And that's our goal. When you're in our office, we're looking to help you prevent those diseases. The best treatment for weight loss is really a collaborative approach. So it's talking with the provider, your family physician. It's also sometimes meeting with a psychologist and getting that behavioral counseling piece involved as well. So the more team approach that I take, I feel the more likely my patients are to have success.